Hi everyone, my name is Mary Janica Tan, and by the grace of God, I just recently passed my NCLEX. It still feels unbelievable to say that I am now officially a registered nurse. And I did it with the help of a very brilliant tutor, Dr. Peter Morante. I started as a negative thinker who was full of fear, but then I changed my attitude about it and I enrolled to his NCLEX bootcamp. And Dr. Moranta trained me to stay positive, to work hard, make it happen, and get that yes, yes, yes. So, with the training and resources he will provide, you'll be golden. But of course, you have to do your duty to study and manage your time. Surround yourself with a good support system and study smart with Morante Associates. Combine it with a positive mindset, and you'll achieve anything you set your sights on. If I can do it, you can do it too. Good luck.
And I just wanted to share how grateful I am that I joined Dr. Peter Morante and Associates NCLEX Bootcamp. I wouldn't have achieved my goals without them. Their tools were really useful. That includes the Zoom classes, the PowerPoint, and testing strategies, Kahoot, assessments. So I utilized them all and passed the NCLEX. And I think I joined like 11 or 13 sessions, including the last one that I still attended the day before my NCLEX. We also did a lot of Kahoot questions, which was really challenging but also helpful because it was quite similar to the actual NCLEX exam. It was short and vague. So yeah, overall, I just wanted to thank Morant and Associates for everything. And if you're looking for a solid and a really good NCLEX review, go for Morant and Associates. You won't regret it.
Proud of you. Okay. And you finished the exam in 25 minutes? Oh my God.
Yes, yeah.
It means you're doing it correctly. That's the result. I did it really well. Proud of you. Okay.
Thank you.
Great. You passed the board. Ready to roll and be one of the best nurse. Happy Nurses Week to us, right?
Yes.
I'll have some good time with you. How many questions did you?
I got 85.
85?
And
Then you're smart. That's the minimum.
Yeah.
Okay.
Di ko alam kung pumasa ako eh. Tapos the next day I got the email.
I got
Malam,
the
like, I didn't even know I passed. The school emailed me first. And they're like,
Oh, the school know already?
Yeah.
Welcome. Congratulations on passing your NCLEX. Marisa Franco, right?
Yes.
How was the NCLEX experience? Was it so easy for you?
It wasn't bad.
Any advice that you want to give our ESN students or anybody that go past the NCLEX?
I think it's learning how to answer NCLEX style questions. I feel like throughout nursing school, everything was more, not textbook based, but more science based. And then when it came to NCLEX, it was strictly safety and knowing what they're asking. It was like a completely different style, but learning how to manage those. And then case studies, it was a pretty huge chunk of it. Every case study was around 6 questions, I think. So really taking your time with those and knowing what they're asking you. If you're not sure, don't pick it. If you're second guessing between two, which one sounds safer. And if you have no idea what they're asking you, come up with your best educated guess.
You ace it. I'm so proud of you. And now you're going to be doing your PULS, ACLS, and BLS and be spreading your wings to become one of the rock star bedside nurses. Am I correct?
Yes.
I'm so proud of you. Hello everyone, welcome to another live review with me. So welcome everyone to Pass NCLEX Lock It In Live Mental Health Next Generation Case Study Edition. Tonight we are not just memorizing facts, we are learning how to think like the NCLEX wants you to think. Mental health questions can feel very tricky because sometimes every answer sounds very caring. But on NCLEX, caring is not enough. We need to answer based from best, safest, and most therapeutic action. So, our formula for tonight is simple: safety first, feelings next, and facts will be the last one. Say it with me: safety first, feelings next, facts will be the last one. In mental health, NCLEX Next Generation, before you teach, before you explain, before you give advice, you have to protect life. Then you validate the feelings. Then you give facts or education when the client is stable long enough to process. So tonight, we will practice priority questions, select all that apply, therapeutic communication, and next generation case study clues. Comment your answers in the chat. Do not be afraid to get it wrong. This is where we lock it in. So before I start, would like to welcome all our kababayans. I'm Filipino American. I'm based here in Los Angeles, California. My name is Pedro Morante. They call me Peter Morante. And I'm the exam strategist, and I've been in Los Angeles since 2008. But this program of yours that will be you will be taking in has been established since 2015. But I've been in the academe, clinical practice, a combination of it, but I've seen the need that there's a lot of students that struggles with test anxiety. And I've seen our kababayans fail their NCLEX. So they come to me like, oh, can you coach us with our NCLEX? Can you coach me with my FNP exam and PsycNP exam? And that's wherein we bring into the table the simplified form of your review. So a lot of students underestimate mental health on the NCLEX because they find that, oh, it's just mental health, it's just psych, but that's a costly mistake. According to the 2026 NCLEX test plan, psychosocial integrity is at least 6 to 12% on the NCLEX RN Next Generation exam and 9 to 15% on the NCLEX PN or LPN. They're the same. Practical nursing and licensed vocational nursing. That means you can easily get at least 10 or more mental health questions on your board exam. But here's what even more important: mental health isn't just tested only in psychosocial integrity category. You'll also encounter them on psychiatric concepts in med search, pediatrics, maternity, leadership, and next generation NCLEX case studies. So every patient, guys, have psychosocial needs. They could be depressed, they could be anxious, or a patient with COPD can be depressed and anxious, and they're not compliant with their treatment plan. If they don't want to go to their clinic, they don't want to go see their doctor. So that's why we really need to address their psychosocial needs. Also, you need to apply therapeutic communication. We'll teach you how to answer those particular questions, safety principles, prioritization, clinical judgment across multiple scenarios. And we struggle with therapeutic communication, suicide precautions, crisis interventions, psychiatric medications, or recognizing mental health emergencies. Those weaknesses can affect your performance throughout your exam, not just on psychiatric questions. So the takeaway is very simple for tonight. Mental health is not a small topic. It is a core nursing competency. So mastering it without a complete understanding is a board trap. You need help in answering psych questions because it will strengthen your clinical judgment across your entire NCLEX exam. So don't treat mental health as very easy, but study with it with the same intensity, such as pharmacology, medical, surgical, nursing, and prioritization. And it could be a difference between passing and having to retake the exam. So you can also adopt this 60-second, 3-minute, or 10-minute um, criteria in terms of prioritization. So here we go, and we'll start with the first question. So all thinking about is safety is a priority. So let's do this first question. A 22-year-old client is brought to the ED by a roommate. The client states, I cannot do this anymore. The roommate reports that the client is giving away their personal belongings and wrote goodbye messages last night. The client admits to drinking alcohol and has access to firearm at home. Now, this is the question: which nursing actions are appropriate? So for those who are joining us from University of Luzon, hello kababayan, Dagupan City, mga ko-Pangasinan ko, welcome to this board live review. And to all those are tuning in from Los Angeles, California, hello. From those who are from Colorado, Hawaii, welcome to this review. And even anybody who is tuning in from UK, India, and also other parts of the world, welcome and mabuhay. So letter A, ask directly if the client has a plan to die by suicide. Do we do this? Letter B, place the client on one-on-one observation. Letter C, encourage the client to sign a no suicide contract. Letter D, remove access to lethal means. Letter E, notify the provider and prepare for emergency psychiatric evaluation. Or letter F, leave the client alone to decrease stimulation. So once again, you are answering select all the reply questions. I will definitely highlight the keywords. 22-year-old. What else? I stating I could not do this anymore. And then they're giving away their personal belongings. That's a red flag. And they're writing goodbye messages last night. And the client admits to drinking alcohol and has access to a firearm at home. Which nursing actions are appropriate? Now, you are looking at a positive or affirmative options, right? You are looking for those correct options. When they say which nursing actions are not appropriate or inappropriate, then you're looking for a negative answer. So everybody, University of Luzon and other students that are taking their NCLEX, or if you're just wanting to study psychiatry and know the nursing content areas, please type in your answer into the chat box. Let us stay engaged as we answer these particular questions. Okay, once again, I could not do this alone. Let's work it out and do this together. So, this question number one is all about suicide risk and priority safety. So, our main teaching point when the client has suicidal statements, giving away belongings, goodbye messages, they're telling you, I love you, goodbye, or they're telling you, this is my favorite family picture, I'm giving it all away to you. This is my favorite guitar, I'm gonna give it to you. And they have an alcohol use and an access to lethal means, and this is a high risk patient. And they require immediate safety action. Okay, so let's look at asking directly about suicide plan. This is very important for our patients. Placing the client on one observation. This is also very important. Removing lethal means is a correct action. Notifying the doctor, the psych nurse practitioner, the medical doctor, and preparing for emergency psychiatric evaluation is also a correct intervention. So remember, NCLEX wants you to be direct. You need to ask about suicide that does not put the idea in the client head, but it gives you data and also protects life. Do not leave your client alone. Don't say, okay, you're fine. I'm going to leave you alone. That's an incorrect option. Do not rely on no suicide contract. That's not enough, according to evidence base. And then safety precautions always comes first. All right, I think everybody got the right answer. Let me check on the chat box real quick. Would love you guys to engage. And the more you're liking this particular content, guys, please share, like, subscribe, or tag your NCLEX best friend or your nursing best friend. If they find value with our content area today, it is important for our community to grow and make sure this is complimentary, free live class for you guys on mental health content areas. All right. So remember, University of Luzon, una sa lahat. So we always need to make sure that a lot of you will pass NCLEX so that you can join us here in United States of America and serve our kababayan out here. So what is the answer? I think Georgina answered A, B, D, E. How about the rest, guys? Type in your answer. Georgina, where are you coming from? Where are you from? We'd love to hear you guys, where you guys are coming from. A lot of Filipinos may be out here. And please, once again, tag your NCLEX best friend, nursing colleague, faculty, or anybody that can benefit from this live stream. So Georgina is coming from New York. Thank you, Georgina, for tuning in. I love New York. My wife is from New York. So it's very close to my heart. And Mark Christian Aquino said A, B, D, E. Where are you coming from, Mark Christian? Diane De La Cruz said A, B, D, E. Thank you. Oh, God. We're getting a lot of answers out here. I love it. So remember, 1 minute per question or 1 minute and 30 seconds will be your maximum. I don't want you to spend 5 minutes, 10 minutes, 30 minutes in one question. You're gonna run out of time. We need to make sure you get the good results for your NCLEX. All right, I guess anybody who still wants to answer, please feel free to type in your answer into the chat box. We're monitoring that, and it's a way for me to stay engaged. Okay, Mark Christian Aquino is from University of Luzon. Mabuhay. Yes, we got this. So, Mark, did you get the right answer? Georgina, did you get the right answer? Let's reveal the answers. So, our past mnemonic and formula here is plan, means, and safety scene. Always remember we need to do your planning, access, and substance abuse for your patient, and also goodbye behavior. We always need to stay with the client and to ensure safety. So the correct answers, you guys are correct. It's letter A, asking directly if the client has a plan to die by suicide. That is very important assessment. Letter B, placing the client on one-on-one observation is also important. We need to make sure that the patient is safe at all times. And letter D, removing access to lethal means. So this may be in the form of contraband. This may be a shoelace, knife, what else? Glass, uh, a gun, or anything that they can use to commit suicide. So make sure you guys are practicing that correctly. And then notifying the provider. Provider on your NCLEX may be called psych NP, healthcare provider, medical doctor, psychiatrists. All of those are providers, the ones that giving you order, and prepare for emergency psychiatric evaluation. So always important that we need to screen for suicide risks. Their suicidal statements very important. We need to prepare for that preparatory behavior that they will tell you. I will hang myself tonight, or I will kill somebody tonight. So remember, active and passive. If they say active, I'm going to get a gun and shot myself tonight. So they have a plan. If they tell you, oh, I don't want to live anymore, but I don't want to hurt myself, then that's passive suicidal ideation. Okay? Always remember priority is safety, and we always need to ask the right questions for them. Okay? And then also escalate the care. Always remember to remove any sharp objects. Shout out to Miss Ruby and Reyes from Anaheim, California. Hi, Ate B. Mabuhay. And then let's go to the next slide, please. So remember our past mnemonics. Safety first, always. So if there's a plan, there's means, always substance abuse and goodbye behavior, those are red flag signs. Letter C, no suicide contracts do not replace safety precautions. Remember that. Letter F, the client should not be left alone. So those answers are incorrect. So all of you got the right answer. Congratulations. You are the next NCLEX passer. You are next from Janica. You are next from Samantha. And you are next from those students that we have proven that our system works. Question number 2. All right, so this is NCLEX Next Generation case study. So we're talking about a major depressive disorder. So you have a 35-year-old client with major depressive disorder is admitted to the inpatient psychiatric unit. Your assessment finding is their mood is stating that they have hopeless and empty feeling. Number 2, their sleep is only 3 hours per night. That's not good, right? We need sleep. And sleep is regulated by serotonin, right? And then your appetite is very poor. Remember symptoms of depression, guys. If you have a friend that is depressed, they are either under eating or overeating. So make sure you guys are good on that. Next, speech. Make sure that their speech is slow and soft. Something like this. I'm so depressed. I'm so down. I'm so blue. All of that. Next, behavior. They're so withdrawn. So if you have a friend that always texts you and suddenly they tend to have a social detachment, then that could be a sign also that they may be depressed Or what else? They could be staying in their room. They don't want to go out. They don't want to go to social function. They don't want to go and do their ADLs. And then medication, they started Zoloft or sertraline 1 week ago. So the nurse enters the room and finds the client is giving away family photos to another client, which finding requires immediate follow-up. So as you can see there, immediate follow-up means red flag. So what do you mean by red flag? We're looking for something that needs to be further assessed. So letter A, is it poor appetite that we needs to be concerned about? Letter B, are they gonna die from slow speech? Hi, Charles Dulay. Thank you for answering. Letter C, giving away their photos, family photos. Is that important? Letter D, if they're sleeping 3 hours per night, does that require immediate follow-up right away? So remember, you have four options, and we need to make sure that when we're looking for these particular questions, right? Our main teaching point will focus on depression. Depression, they have poor sleep, poor appetite, and slow speech. These are all concerning. But if you look at one option here, there is a suicide warning sign. Once again, there is a suicide warning sign that we need to remember. Okay, so this is a next gen pass clue. The test gives you several depression symptoms, but then gives you one behavior that screams danger. So, giving away meaningful items can mean preparation for suicide. So, if the patient is telling you, this is my favorite guitar, this is my favorite jacket, this is my favorite necklace, or this is my favorite bracelet, then that finding needs immediate follow up. So, remember, goodbye messages, giving away things, sudden calmness for your patient is a suicide risk. So let's look at the answers. Oh, Shasta, welcome to this review. Answered letter C. Georgina answered letter C from New York. Charles from University of Luzon answered letter C. Ruby Andreas answered letter C. How about the rest? If you're tuning in, once again, we want to hear from you. And if you have a friends that will benefit from this review, please tag them and allow them to listen to our content areas. If they have taken the NCLEX and was not successful, this is particularly important for them. You can actually help one friend at a time. Send this link to them and make sure they're tuning in. All right, let's reveal the answer. Okay, so giving away family photos. Remember, giving away possessions. If they tell you, okay, this is a very important thing for me, I want you to keep it. This is my very important guitar. This is a guitar that was given to me by my brother. I'm giving it away to you. Then that means they're gonna commit suicide. We need to make sure we're sensitive to that, right? But you've seen patients dancing and being on a manic stage. The time they were in there on manic stage or posting different videos or posting TikTok videos and then suddenly committed suicide, they got a gun, shot themselves in the hotel. That means the only time that the patient will commit suicide is where in their energy it at its highest level. When their energy level is at its lowest, they don't want to commit suicide. So always remember, when your patient has erratic behavior, they have mania, then that means we need to pay attention to that. They're gonna be committing suicide. Highly important board topic review. You need to make sure you master that. Once again, when do they commit suicide? When their energy is high, not when their energy is at its lowest. Very good. So once again, if you like the value of this, very important, past mnemonic, goodbye is a red flag. Remember the song, I love you, goodbye. So giving away things like this, sudden calmness, and they have a red flag risk and their depression is so high. So they have poor appetite, it's very common in depression, but we need to monitor them, but it's not the most urgent. Remember that, okay? So when you compare letter A with other options, which is letter C, C has more weight on it. Slow, soft speech can occur with major depressive disorder due to low energy and psychomotor slowing, but it's important, but it does not immediately indicate danger. Letter D, insomnia, is concerning and should be addressed, but it's not as urgent as the client giving away their belongings. So once again, remember, I love you, goodbye. So when they tell you goodbye and they're giving all their personal belongings, it's red flag. Okay, thank you. Thank you, Crystal Moranta. Shout out to my wife. Thank you for tuning in also. Next. All right, let's do question number 3. Okay. So this is a therapeutic communication anxiety. A client experiencing severe anxiety says, I feel like I am losing control. I cannot breathe. The client is pacing and speaking rapidly. Which responses by the nurse are therapeutic? So once again, which responses by the nurse are therapeutic? So we're looking for affirmative answers or correct answers. Select all that apply. Letter A, calm down. Nothing bad is happening. Is this therapeutic or non-therapeutic? Is this an affirmative answer or a negative answer? Letter B, stay with me. Let's breathe together slowly. So is that therapeutic or is that non-therapeutic? Letter C, you are safe here. I will stay with you. So if you tell that to your patient, will they feel more calmer or will they feel more reassured? Letter D, why are you feeling anxious? Is that therapeutic or non-therapeutic? Remember, golden rule, asking why is always non-therapeutic. And then this is belittling their feelings too, right? Or challenging their emotions or arguing with the patient is non-therapeutic. Letter E, let's move to a quieter area. So you want to move them to a quiet area. Or letter F, you should not be this upset. I know sometimes we hear this in the clinic, in the inpatient setting, that a nurse will tell you, you should not be this upset. So is that therapeutic or non-therapeutic? Type in your answer into the chat box, guys. We got this. Once again, our NCLEX live review is brought to you by Past Reviews Center. Once again, our complimentary NCLEX Next Generation Past Review live review is available for you guys. So please like, share, subscribe, and share this link to your friend. Charles Dulay said letter C and letter E. And then Georgina said B, C, D, and E. So let's look at those questions that are important for you. So remember, our main teaching point here is for severe anxiety, we have to use short, simple, calm statements. So always stay with your client and always decrease stimulation. So, what are examples of therapeutic responses that we can tell our patients for somebody with severe anxiety? So, example is stay with me, let's breathe together slowly. I think this is very therapeutic. Or do you tell your patient, you are safe here, I will stay with you. That's also very therapeutic. Or let's move to a quieter area. This is an intervention of decreasing stimulation. So when your anxiety is so severe, your brain cannot process long explanations. Have you ever noticed that when you're anxious and somebody's trying to explain things to you and you're not able to digest them correctly? So the same thing, the brain is overwhelmed and the brain is overly stimulated already. So you don't want to give long explanation to your patient. Do not ask why. Do not say calm down. Do not minimize their feelings. Stay close, keep it simple, and reduce stimulation. Remember, those are the most therapeutic interventions that we have. Okay, let's reveal the answer then. Remember, letter B, stay with me, let's breathe together is very therapeutic. Letter C, you are safe here. I will stay here with you. Remember, that's very therapeutic and you are offering yourself to your patient. That's very important. Letter E says, let's move to a quieter area. So remember, you can bring them to a quiet room, but if they have history though of aggression, you don't want to go with the patient and you alone in the room. You need to have somebody with you. And then another important topic is that if they have a history of aggression, they have hurt staff or hurt somebody, you need to stay where the door is or close to the door so you can exit out the room effectively. So during anxiety, remember that the nurse should use simple, short statements. You also need to remain calm, stay with your client, reduce stimulation, and assist with breathing. So, what will be our past mnemonic here or past formula? So, remember SIT, sit. So, what do you mean by sit for severe anxiety? Letter S stands for stay with your client. Okay, remember that. Letter I stands for instructions, needs to be short and simple. Remember, you don't want complex or long explanation. The same thing when somebody's mad at you, they don't want your long explanations. When somebody is anxious, they don't want short and they don't want long and complex explanations. Letter T stands for take away the stimulation. So you want to bring them to a quiet area. You want to bring them where there's less stimulation. So it could be farther away from the nursing station. Because as we know, nursing station guys, it's a lot of stimuli out there. Or when there's a lot of visitors, you don't want to put the patient there. So remember, when there's severe anxiety, you gotta sit. SIT. Once again, stay with your client. Letter I stands for instruction, needs to be short and simple. And then also letter T stands for take away the stimulation. They don't want any outside noises. You want to make sure that they regain their control. Remember that. And then teach them about deep breathing exercise or the grounding technique. Tell me five things that you can see. Tell me five things or five sense or five objects that you can see in the room, or touch the table so that they could be grounded with the stimuli and be more calmer. What else? You can tell them count 1 to 10 backwards. So tell them 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Once again, you can repeat them counting from 10 to 1 backwards. Okay, so that they can regain their control. Or if they have severe anxiety, ask them to clap their hands like this. What's going to happen if they're hyperventilating, guys? They're losing a lot of their carbon dioxide. So they will have like your respiratory alkalosis. Remember that? You're removing carbon dioxide, they can have respiratory alkalosis. If they're hypoventilating, they will have respiratory acidosis. So there are different things that the NCLEX could ask you questions. So you really need to make sure you boil down to your mnemonics, you understand the scenario, the situations, and what is important is your strategy. Right? I think everybody got it correct, right? Olayinka Aditona, where you coming from, or where you from? Let us know. It is important for me to engage with all of the audience out here. So please make sure you join the chat box and type it in. So Miss Aditona, where you coming from? Thank you. Next slide, please. All right. The next question will focus on schizophrenia, delusions, and reality. Okay. So a client with schizophrenia says the television is sending me secret messages. The government is watching me through the lights. Which nursing responses are appropriate? So you have to answer this and select all that apply. Remember, don't be afraid with SATA. SATA stands for select all that apply. So letter A, that sounds frightening. Oh, Olayinka Aditona is from Texas. I love Texas. Which part of Texas are you tuning in from? So letter B, I do not see cameras in the lights, but I believe you feel afraid. Letter C, you need to stop thinking that way. Is that therapeutic or non therapeutic? Letter D, tell me more about what you are experiencing. Is it therapeutic or non therapeutic? Letter E, the government is not watching you. That is impossible. Or letter F, let's sit in a quieter area together. All right, thank you. Miss Olayinka Aditona from Texas. Type in your answer into the chat box. University of Luzon, una sa lahat. Type in your answer into the chat box. Kababayan ko that are tuning in, please engage with the comment box and know where you guys are coming from. So this is particularly delusions and reality orientation. So our main teaching point will be to validate their feelings, but do not validate the delusion. Do not argue with the patient. So if you tell your patient that sounds frightening, you're kind of like validating their feelings. I do not see cameras in the lights, but I believe you feel afraid. Tell me more about what you are experiencing. Let's sit in a quieter area together. So remember, do not say that's impossible. That argues with the delusion of your patient. And then that will further cause mistrust to your patient. So do not argue with the delusion because that can increase mistrust. Also, do not agree with the delusion. So you can tell them it's just you and me inside this room. I do not hear any voices or I do not see any spiders in the room. So make sure you state a fact and reorient them with reality. Next, the NCLEX safe response is always to acknowledge emotion, briefly present. We have to offer them or present reality and reduce stimulation. So once again, feel, don't fight, validate their feelings, do not argue with the delusions. So the answers are letter A, letter B, letter D, and letter F. These are the therapeutic response, guys. The rest are non-therapeutic. Princess Anne Mandap, shout out to you. Once again, Olayinka, remember it's a select all to reply. You need to make sure that you are answering the questions correctly. So why the other answers are incorrect or wrong? Letter C is very judgmental. Letter E, you are arguing with the delusion, and this will further increase mistrust to your patient. So once again, our past formula mnemonic: feel, don't fight with your patient. So you gotta validate their feelings, but do not validate the delusion. We have to acknowledge their emotion. We have to redirect reality. So feel, validate their emotion. Do not fight, do not argue, or do not validate the delusion. And always remember, present reality. Okay? I guess we will have a lot of NCLEX passers in this room. I'm so impressed by your answers. And if you are tuning in once again, please join our comment section. I wanted to hear from you guys and making sure that we are in this together. Your NCLEX journey should never ever be hard. We'll make it simplified and easy for you to be called NCLEX passer this year. You have to have a goal, and your goal is to pass. So you have an option to pass or to pass, right? Failing is never an option, and that's why you're here, because you want to pass this year for NCLEX and make an impact to the community. Once again, welcome to those who are just tuning in right now. Next question, please. Next slide. Next, we go with bipolar mania, which is our priority intervention. So you have a client with bipolar disorder is admitted during a manic episode. The client is facing, talking loudly, and has not slept for 3 days and says, I have unlimited energy. The client has eaten only a few bites of food since admission. So this is a full-blown mania. Which intervention should the nurse implement? Select all that apply. So once again, do not be afraid with select all that apply questions. The more that you're getting complex question in the NCLEX, I think it's a green sign. So once you get select all that apply, do not panic. It may be a true or false statement only. Letter A, provide high calorie finger food. Is this a true or false statement? Letter B, encourage long group therapy. Is it a true or false statement? Letter C, reduce environmental stimulation. Is this true or false statement? Letter D, set clear and informed limits. Is this a true or a false or incorrect response? Letter E, encourage frequent rest periods. Do they need it? Do they not need it? Is this therapeutic or non-therapeutic? Letter F, do we debate the client's unrealistic ideas? So once again, we have to be always therapeutic to our patient. Never ask why, never what, belittle their emotions. Do not say everything's gonna be okay, you're in good hands, you're in the best hospital. I am the best nurse in town. So make sure you guys are not answering based from those responses. They're very non-therapeutic. So this is a case wherein mania. Mania will put the patient at risk for overexhaustion. What else? Your patient on mania will be prone for dehydration. Your patient on mania will have a poor nutrition. Your patient on mania will have impulsivity. Your patient on mania will be prone also for injury. So those are things that they are at risk for. Once again, they are at risk for exhaustion, dehydration, poor nutrition, impulsivity, and injury. So letter A, providing high calorie finger food. This is very important. So you can just give them like a chicken tenders. As we know, chicken tenders are rich in protein and they could eat while they're facing back and forth in the hallway. So that's a correct option. So remember that. So finger foods, reducing stimuli is very important. Setting clear limits and encouraging rest is important. So a lot of your manic clients may not sit down for full meals. So give portable high calorie foods. Do not overstimulate your patient with long group therapy. They're gonna be bored or they're not appropriate for that. We have to set limits clearly and calmly. So we have to set a clear, healthy boundaries. We gotta create therapeutic alliance, not therapeutic rupture. When there's therapeutic rupture, they don't trust you. Therapeutic alliance, they do trust you. So promote rest because the body is running on overdrive. So think about our past formula. So remember our past formula. Next slide, please. So you gotta feed, you gotta calm, you gotta limit, and you gotta rest. So basing from this one, mania is move, munch, minimize. Remember that, okay? Moving, high energy, they are facing, they are nonstop, they have so much energy, guys. Or they could what have like a lot of like sexual encounters in the bar in one night. They will tell you I had sexual intercourse with 20 guys last night. And that could be different people, or they could be swiping their credit card and they're maxing out their credit card like 20,000 or 50,000 in one night for things that they don't need. So remember, letter M stands for munch. Offer easy to eat finger foods and fluids. I will answer like chicken tenders. That will be good for them. And then minimize or reduce noise and crowds and extra stimulation. So anything that is overly stimulating is an incorrect response. Anything that is arguing can escalate agitation. Never ever ask why. I guess all of you answered it correctly. A, C, D, and E. Remember in NCLEX, they can give you a partial credit or a full credit. So you need to make sure you get the select all the reply correctly, right? So do not be afraid with next generation exam. This is doable exam for you guys. It's just based on case study format. Next question. All right, so this is a next gen case study and we're going to talk about alcohol. Remember the song Blame It to the Alcohol? So remember, alcohol withdrawal is an anticipated issues that we need to make sure to remember. So you have a 48-year-old client who is admitted for alcohol withdrawal. And this is the timeline. At 8 o'clock, the patient is showing tremors, anxiety, and diaphoresis. What is diaphoresis, guys? They sweat a lot. At 10 o'clock, they have a blood pressure that is elevated. So the systolic pressure is 162. The diastolic pressure is 94. And then the heart rate is 118. Remember, if there's restlessness, anxiety, tachycardia, those are red flag symptoms. At 12 o'clock, the patient reports seeing insects on the wall. So they will tell you, I see insects on the wall. They're everywhere here. Okay? And then at 12:30, they become confused and agitated. So once again, agitation is restlessness, anxiety, and tachycardia. Once again, RAT, restlessness, anxiety, and tachycardia are early symptoms of hypoxia. Now, which provider prescription should the nurse anticipate? Remember, you gotta wear in your registered nurse or LPN hat when you're talking to when you're dealing with NCLEX question. So letter A, are we gonna give lorazepam? Lorazepam is also known as Ativan. This is the first line drug of choice for this patient. Letter B, are we gonna give fluoxetine? Fluoxetine is also known as Prozac. So remember in your NCLEX, they're gonna give generic. So are we gonna give Prozac, which is an SSRI? Or letter C, haloperidol only. So this is a technique on your exam. When there are options that says only limits the option. So when there's all, never, none, everyone, only, sometimes they are the incorrect response because they limit the option. So haloperidol is also known as Haldol. So this is your antipsychotic first generation. It's an antipsychotic that we use for schizophrenia. So you need to make sure that if they are first generation or second generation, our main issues for them is weight gain, and also at the same time there could be neuroleptic malignant syndrome. So letter D, is this disulfiram? As we know, disulfiram is used for abstinence maintenance. This is not used for acute alcohol withdrawal. So we already limited the options. So let's take out letter C. Let's take out letter D. You're torn between letter A or letter B. What is your answer? Hi, Maricel Pangan. Welcome. She's from California. Thank you for tuning in. So once again, this is a case study format for acute alcohol withdrawal. Hi, Princess Anne Mandap, letter A. So remember, do the power of leverage between Ativan and Fluoxetine, or Prozac versus Ativan. Then you're gonna choose between that. Hi, Van Tivangin from Northern California. Thank you and welcome. All right. So type in your answer, guys. Is it Alpha, Beta, Charlie, or Delta? All right. Remember, what is 90 days versus a lifetime? You gotta make sure you test out before 3 months of your exam, or before 3 months after finishing your program. So if you're done on July 7, August, September, October 7 will be your last day to take the board exam. 90 days window period. But you can test out longer than that, will reduce your rate of passing the exam. So make sure you follow the 3 months rule. Okay. All right, what is the answer? Let's reveal it. So remember, your main teaching point here is that the patient is undergoing acute alcohol withdrawal and they can progress to seizures and delirium tremens. So our benzodiazepines is the first line of action or first line drug of choice. So if they have tremors, they have anxiety and they sweat a lot, they have high blood pressure, they have rapid heart rate or tachycardia, or they have hallucination, they're seeing insects that is not in the room, and they have confusion. These are acute alcohol withdrawal syndrome. Getting dangerous, right? And then we need to make sure that we give benzos because they will help them to prevent seizures and delirium tremens. So letter B, fluoxetine is for depression, not acute alcohol withdrawal. Haloperidol may calm the agitation, but it does not prevent your acute alcohol withdrawal seizures. Disulfiram is for abstinence maintenance and not for acute alcohol withdrawal. Remember, if they are on disulfiram, very important is to make sure that there's no alcohol containing substances they can induce, like make sure that they have alcohol free mouthwash, and make sure you check what they're eating because sometimes condiments could have alcohol on it and no wine. So remember that no alcohol for patients on disulfiram or antabuse. All right, next slide. So remember, the past mnemonic, our past mnemonic is withdrawal equals benzo before seizure. Alcohol withdrawal can kill, and think benzodiazepine first. Acute alcohol withdrawal can kill you once again. We want to avoid seizure from happening. We want to do early treatment so that we can save lives. Once again, you are in it to win it. Great job. Mark, Zavina, Georgina, Van, Charles, Princess, and Marcel, thank you for answering correctly. You are in it to win it. Wow, let's go to question number 7. Okay, we're going to talk about lithium toxicity. In this particular question, we're looking at GI symptoms, we're looking at weakness, coarse tremors, lithium level, and then make sure you guys know the signs of toxicity. So you have a client taking lithium and reporting nausea, vomiting, diarrhea, muscle weakness, and coarse hand tremors. The lithium level is 1.8 milliequivalent per liter. Which actions should the nurse take? Select all that apply. Is it letter A? Do we hold the lithium dose? Correct or incorrect option. Letter B, do we notify the provider? Call the doctor very quick. Letter C, do we encourage the client to drink or encourage the client to restrict fluids. I will make sure that they are well hydrated, especially during summer, because what's going to happen if they are dehydrated, the lithium levels goes up. Letter D, do we assess renal function? As we know, guys, lithium is nephrotoxic. Lithium, guys, is cleared by the kidneys. So dehydration and low sodium can increase the lithium levels. So if the client is vomiting, diarrhea, weakness, coarse tremors, do not give more lithium. Remember that, okay? And then, do we do letter E? Prepare or administer more lithium. Remember, I told you they have a narrow therapeutic index. So do we give that or not? And then, do we do letter F? Monitor neurologic status. All right, monitor neurologic status. They could word that as neurological status or neuro status. They're the same. Okay, make sure, guys, you know how to answer this correctly. Okay, so Alpha, Beta, Charlie, Delta, Elephant, or Fun. Type in your answer into the chat box. Once again, you can do it. NCLEX is doable. It's just a process. Select all that apply is easy as long as you know how to eliminate options and how to analyze them. Georgina answered. Charles Dulay have answered. How about the rest? Once again, if you're liking what you're hearing from us, please tag your friends. We're pretty much um, helping you guys pass the board exam, and this is brought to you by Pass Review Center. So remember, low salt equals lithium volts. We're looking at low sodium or dehydration that can make our lithium levels rise. So for you to answer this question, you gotta know the therapeutic index or the normal levels of your lithium. Okay, remember zero point 0.6 to 1.2. Let's reveal the answers. Everybody was given an opportunity to answer. Thank you, Kim, and thank you, Daphne. All right, we gotta hold the lithium dose. Thank you, Van. We gotta make sure notify the doctor very quick. It may be the psych nurse practitioner too. We gotta assess renal function because we know that lithium is what cleared by the kidneys. And then we gotta make sure we monitor for neurological status. So let's look at our past mnemonic. I love your answers, guys. A, B, D, and F. Great job, everyone. So lithium toxicity, they have a coarse tremors. So if it's a fine tremor, it's okay. And then we're thinking about tummy. Tummy stands for GI upset. NBD, nausea, vomiting, diarrhea. So once again, think about your NBD, nausea, vomiting, diarrhea. And they have trouble walking and they have confusion or weakness. So once again, they have ataxia. This is red flag. They have confusion. They will tell you, where am I? Is this the hospital? Is this my home? So a lot of your patients will be very confused, and this could mean that there's a safety concerns. So remember, low salt lithium bolts. Once again, hyponatremia, 135 to 145. So if they say 120 sodium, that's low. So the lithium levels can go higher than usual. So we're looking at kidney function. Remember, they're nephrotoxic. So if your patient has proteinuria, so if they pee and there's protein, it's bad sign for your lithium. Remember that there should be no protein in the urine. Protein, guys, is macromolecule. When we say macromolecule, they are large. Macro means large. Micro means small. So it's not normal for protein to be present once we look at the urinalysis of your patient. Remember that. Hot topic. You are in it to win it. You are the next NCLEX passer. I can hear it, I can see it, and we can claim it this year. Next question, please. Question number 8. I'm going to talk about urolaptic malignant syndrome. So a client taking haloperidol develops a body temperature of 40 degrees Celsius. They have severe muscular rigidity, confusion, diaphoresis, which is sweating, excessive sweating, and unstable blood pressure. Now, which actions are appropriate? Select all that apply. Is it letter A? Do we hold the antipsychotic medication? Do we do letter B? Do we notify the provider immediately? Do we do letter C, prepare for emergency treatment? Do we do letter D, encourage the client to continue taking haloperidol? Letter E, do we monitor temperature, cardiac rhythm, and vital signs? Or do we do letter F, recognize this as a life-threatening reaction? So type in your answer into the chat box. Alpha, Beta, Charlie, Delta, Eggplant, or France. Alpha, Beta, Charlie, Delta, Eggplant, France. Type it in your answer. Lock it in, guys. We got this. So we're thinking about NMS. Remember, your NMS, guys, is a life-threatening reaction to antipsychotics. Your patient is on haloperidol. That's an antipsychotic. Now, they have high fever. They have severe muscular rigidity. They have confusion. They have diaphoresis and unstable blood pressure. So highlight those. Do we need to hold the antipsychotic? Definitely. Remember that if we're gonna continue giving it, like letter A, hold the antipsychotic, and then letter D is encouraging the client to continue taking haloperidol. It's opposite. When you have two options that are opposite, one of them could be the right answer. Marcel answered A, B, C, and F. So do we notify the doctor very quick? Definitely. Do we prepare for emergency treatment? This is NMS. Remember, they need to be hospitalized. They can usually recover 4 weeks, 6 weeks, or 8 weeks at the most. This is more severe than your serotonin syndrome. Do we monitor vital signs? That's very important. Do we monitor cardiac rhythm? Very important. Do we monitor temperature? Very important. And this is this life threatening? Of course, neuroleptic malignant syndrome. So they love to test you guys on NMS against serotonin syndrome. Remember, your NMS is antipsychotic. Your serotonin syndrome is on for your serotonergic medications. So if they have fever, they have uh, uh, pipe lead rigidity, and then also you have altered mental status. This is not monitor in weight. This is emergency care. Remember that. So if they have hot, stiff, and they're unstable, this is NMS. So let's reveal the answer, and I think most of you have answered it correctly into the chat box. Very good. You have to hold the antipsychotic. You have to notify the doctor very quick. You have to prepare for emergency treatment. We have to monitor the temperature and cardiac function, and then we need to make sure we treat this as a life-threatening situation. So once again, we're looking at muscular rigidity, severe mental status, autonomic instability, and elevation of your creatinine kinase. Very good. Okay. So what is our past formula? Remember, NMS, hot, stiff, and confused. So they're hot, they will have a fever, and their blood pressure will always going to be higher than usual. They have stiffness in their muscles. So remember your muscular rigidity, and they have acute confusion. So they have altered mental status, confusion, and agitation. So remember, hot, stiff, and confused. So remember, letter D is very unsafe because the antipsychotic should be stopped. Remember, when there are two options that are opposite, one says continue, one says discontinue, then you have to choose between the two. Okay? Do the power of negation or opposition. Wow, next question. We're going to talk question number 9. And as we all know, Karen Carpenters from the Carpenters died from anorexia nervosa. So a lot of celebrities, Hollywood stars struggle with this. Even regular people, could be an employee in Walmart, in Target, can suffer anorexia nervosa or an eating disorder. So you have a 19-year-old client with anorexia nervosa is admitted with severe weight loss. Now this patient's vital signs are as follows. They have 88 over 54 hypotension. They have HR 48, that's bradycardia, and they have a temperature of 35.8 degrees Celsius, that's hypothermia. The client says, I am still too fat. So they look at themselves in the mirror, they think they're so fat, but actually they're so cachectic, they're so thin. And then which nursing interventions are appropriate? Select all that apply. Letter A, monitor the daily weight using the same scale. There. Do we do this? Letter B, stay with the client during meals and after meals. Letter C, do we allow the client to exercise after meals to decrease anxiety? Letter D, do we monitor electrolytes and cardiac rhythm? And then letter E, do we provide a structured meal plan? Letter F, do we focus on debating the client's body image belief? So type in your answer into the chat box. So think about your anorexia nervosa. Remember, they can cause bradycardia. They can cause hypotension. They can cause hypothermia. They can cause electrolyte imbalance and dysrhythmias. So, what are your correct interventions here? Remember that it's very important to use the same scale when we weighing the patient. Staying with the client during and after meals is very important. Remember that. Monitor electrolytes and cardiac rhythm, particularly potassium, for your patient. Because remember, if your potassium is low, there will be what cardiac dysrhythmias, or they could die from cardiac arrest due to cardiac arrhythmias. They will have what irregular heart rhythms. And then provide structured meal plan is very important. Do not allow exercise after meals for your patient. That reinforce weight loss behaviors. Do not debate body image belief. Remember, our priority is medical safety. We have to focus on nutrition of your patient. We have to make sure there's nutrition structure and cardiac monitoring. So as a registered nurse, LPNs, we collaborate with the dietitian, we collaborate with the psych NP, we collaborate with the psychiatrist, we collaborate with nutritionists. So there are different collaborative efforts that we need to know. And remember that you guys will be talking to this staff in the or healthcare workers, because it's very important to do a collaborative efforts for eating disorder. Remember, with anorexia, we have to protect the heart. We have to monitor the weight, the meals, and electrolytes and rhythm. Thank you for all your answers. Dominic F. answered, Daphne, Vantibangin, Kim Alvandia, Marisol, Georgina, Mark Christian, thank you. And Tali Chris, welcome. So we have a mixed audience from the Philippines, from University of Luzon. Thank you for your partnership, Dr. Dean Lego. We raise our flag. Thank you so much po for the trust, and thank you for choosing us for this board preparation. And then also at the same time, a lot of California are enrolling with us, but we also get Guam students. So thank you for the trust. So this is the answer. Monitor the daily weight using the same scale, same patient, same clothing, same scale, same time each day. Stay with the client during meals and after meals. That will be monitoring if they are actually finishing the portion of food. Collaborate with the nutritionist or dietitian. Monitor electrolytes and cardiac rhythm, particularly potassium. Remember potassium, sodium. Remember, potassium is inside the cell, sodium is outside the cell. So think about your mnemonics PISO. Potassium is the main electrolyte inside the cell, sodium is outside the cell. And then provide structured meal plan, very important. So for anorexia, guys, our past mnemonic, very important. So anorexia, low and slow. So low body weight, low blood pressure, low heart rate, bradycardia, low body temperature. What else? They could have amenorrhea, and they could also have like lanugo. What is the reason why they have lanugo or facial hair? They have facial hair because they want to keep their temperature. It's a way or a mechanism of our body to compensate from hypothermia. So you will observe that a patient with anorexia could have those manifestations of lanugo and also amenorrhea. So very important, once their menstruation is continued or they have a regular menstruation, it's a good sign. Once they're gaining weight, it's a good sign also. Once their electrolytes are in harmony or in homeostasis or in balance within normal level, then that will be a good sign also that the patient is recovering from an eating disorder. Remember, you do not want your patient to suffer alone. There's psych nurse practitioner, therapists that are specializing with eating disorders. You have help. For those who are experiencing anorexia nervosa, you are not alone. Come to come to us, mental health professionals that are able to help you out. There is hope. There is a treatment. There is therapy. There is medication that can help you survive eating disorder. Um you don't want to suffer in silence and die alone. You have help, guys. Okay? Dial 988 if you have to, if you feel like you're suicidal or homicidal. and you think that you're starving yourself. Okay, so why eating disorder patients can die from their home? They're starving, they're dehydrated, they are experiencing cardiac distress. So make sure to check on your friends that are struggling with eating disorder. So please do not tell your friends, oh, you're so fat, oh, you're so thin, right? Those comments, guys, could hit them. Make sure be kind to your description, especially during parties. And I know sometimes we are not mindful about what we say, particularly, oh, you eat too much, oh, parang tumaba ka, oh, parang pumayat ka. Those words, guys, can can strike that person, and then they will say, oh my god, there must be a problem with me, right? So tumatatak po siya sa utak natin. Please be mindful about our words and be kind. No bullying about our body forms and body shape, or else magkakaroon po ng body dysmorphic disorder ang ating mga pasyon, ang ating mga family and friends. So let's be kind and choose kindness. Do not do body shaming. And no cyberbullying, even on Facebook, Instagram, or any forms, guys. I'm just against bullying. Okay? Next. Nobody deserves to be bullied, right? Let us choose to be kind. I think this is the last question for the day. Whew, 10 questions. A 30-year-old client is seen in the clinic after surviving serious motor vehicular accident 4 months ago. Now, these are the symptoms. So in the case study format, guys, once you click on symptoms, it will reveal the and once you click on client report, it will reveal it. So there's a chevron there that you need to press. Remember, read everything. Symptom, client report. So there's sleep. They're telling you that they're reporting to you about nightmares. Remember, prazosin is good for terrible scary dreams. PTSD, prazosin for terrible scary dreams. Mood, they're irritable or detached. Behavior, they avoid driving. I keep seeing the crash in my mind. So I have a patient like this too. Safety, denies suicidal ideation. So, which findings are consistent with post traumatic stress disorder? Remember, this is a PTSD next generation NCLEX case study. So, our main teaching point, guys, is number one, we gotta involve trauma exposure followed by intrusive symptoms. So, you will see your patient will have issues and symptoms of PTSD. So, letter A, nightmares. Letter B, avoidance of driving. So they will tell you, oh, I don't drive in the freeway. Oh, I don't want to drive. It makes my heart race. It makes me have a panic attack. I could not even hold the steering wheel. Letter C, flashback or intrusive memories. Letter D, symptoms lasting more than 1 month. Remember, timelines very important for PTSD. Letter E, elevation or elevated mood and decreased need for sleep. Letter F, detachment from others. So type in your answer into the chat box, guys. So what is the main teaching point for this question? Thank you, Mr. Chris. Tally Chris, welcome to this live review brought to you by Pass Review Center. With Pass, you will pass your exam. So main teaching point, PTSD involves trauma exposure. They are followed by intrusive symptoms, right? Avoidance, negative mood, cognition, hyperarousal. Usually they are lasting more than 1 month. So what are the correct findings? Type in your answer, guys, into the chat box. And once again, if you are testing for your NCLEX, guys, there is a formula, there is a process. You gotta make sure you do your practice questions. Look at the rationals. Why not A? Why not B? Why not C? Why not D? Why not E? You gotta read the rationals. The more you do practice questions each day, the more you're gonna do better on your NCLEX. And then always follow the program and the protocol. We're in it to win it. We trust that you don't overthink when you're testing for your exam. We trust that you don't change your answers regularly. That's like a board trap. We trust that you will manage your test anxiety. So our program works and we have proven it. There's no fluff, there's no overthinking, anything that you need to know for your NCLEX. All right. Thank you, Georgina and Marcel, for answering. So what are the keywords? Nightmares, avoidance, flashback, intrusive memories, symptoms lasting more than 1 month, and they have what? Detachment or from others. So the timing matters, guys. PTSD is more than 1 month after trauma. If it's less than 1 month, it's gonna be acute stress disorder. So the clues are nightmares, they have avoidance, they have intrusive thoughts, they have or intrusive memories, detachment, irritability, hyperarousal. Elevation of the mood and decreased need for sleep is more mania. They are not PTSD. So I will eliminate letter letter E. So what is the answer? Let's reveal it now. Next slide, please. So alpha is nightmares. Beta is avoidance of driving. Remember, I told you, friend will tell you, I don't want to drive in the freeway, especially 405, 1 or 605. It's always traffic, right? Flashback or intrusive memories, symptoms lasting more than 1 month, and detachment from others. So letter B is incorrect because that's more, or letter E is incorrect because that's more for your mania. So let's look at the past Pearl formula. PTSD is trauma, there is intrusion, there is avoidance, there is mood change, and it lasts more than 1 month. So make sure, guys, remember that. Do not overthink when you're testing for the NCLEX. Use safety first, and basically always remember, ask yourself, is anyone in immediate danger? NCLEX is not asking what is nice options. NCLEX is asking what is the safest. Remember that. And also for select all that apply question or SATA question, treat every option like true or false. Do not group them together. So is letter A true, letter B true, C true or false? And then always validate the emotion and not the delusion. Always think about teaching comes later. We always need to make sure that safety comes first. All right, let's look at everybody's options and answers. No, they should have depressed mood, correct. And basically, all of you answered it correctly. Great job, everyone. Woohoo! Tonight we have practiced the way the NCLEX wants you to think. So safety first, feelings next, and facts will be last. For mental health, remember if there is suicide risk, we stay with your client, you assess, you remove the danger before, and also you escalate them. If there is anxiety, keep it short, keep them calm and simple. If there is psychosis, validate their feelings. Do not argue with the delusion. If there is mania, reduce stimulation, set limits, feed and rest the patient. If there are medication emergencies like lithium or NMS, hold the medication and escalate the care. This is how you pass the NCLEX, not just by memorizing every sentence, but by recognizing the pattern and also choosing the safest answer. Thank you for joining us here at Pass NCLEX Lock It In Live. Please like, share, tag a friend who is preparing for NCLEX, and please stay connected with us with Pass Review Center. We've been around since 2015. We're celebrating our 11th year this year, and we are here. We are here to help you pass, protect your patients, and become the nurse that you are called to be. Lock it in. You got this. Make sure, guys, we have 2026 sessions. July is my favorite month aside from being my birthday month. We are offering you guys an NCLEX live review. Our next NCLEX live review will be obstetrics from July 14. Please watch out for the announcement for registration. July 21 will be pediatrics. July 28 will be advanced med surge. But for those who are tuning in from different ones, please make sure to scan the QR code right now, especially if you are Philippine time, 9 a.m. So from Hawaii, 3 p.m., Pacific, 6 p.m., Mountain, 7 p.m., Central Time is 8 p.m., and then Eastern Standard Time is 9 p.m. Once again, thank you for entrusting us, and we are gonna pass together. We're gonna walk you through how to take the exam. I'm gonna work with you side by side. Please follow and share if you're finding value with this link. Once again, my vision, why I created Past Review Center. I will break it down with letter P. I wanna pay it forward. I started Past Review Center because someone once believed in me. So, as a Filipino American nurse practitioner, I know the sacrifices, resilience, determination it takes to pursue this profession. Past is my way of paying those blessings forward by helping others achieve their dreams. So remember, once a dreamer, I believe in my dreams, and you will survive. So dream, believe, and you will survive this exam. Letter A, I want to give access to all. So a lot of my students says, okay, why you're doing this live review? Education should never be a privilege reserved for a few. I believe in every nursing student and nurse practitioners, regardless of your background, your finances, your color, or whether or where you live. We deserve access to high quality, evidence based NCLEX preparation and board preparation. So, Past Review Center was built to make success attainable for everyone. Letter S, service before self. PASS is more than a review center. Its mission is for service. Every lecture, every question, every mnemonic that we're giving you, and every live session is created with one purpose: to empower the future nurses who will go on to care for patients, families, and communities with competence and compassion. Another letter S is strengthening our legacy. As a Filipino American, we have a proud legacy in nursing. I want Past Review Center to honor that legacy by inspiring excellence, uplifting the next generation, and proving that when one nurse succeeds, countless lives are impacted. So our goal isn't just to help pass the NCLEX. We want to help build a community of confident nurses who will make healthcare better for all, because every passers is more than the exam that they have passed. It is a dream fulfilled, a family uplifted, and a community strengthened, and a patient whose life will one day be changed by us. So thank you for entrusting us. I will see you in the next live. I love all of you guys. Thank you for tuning in. Mabuhay and salamat po. Thank you so much, pastors. See you on the next live. This is Pedro Morante, your exam strategist. You got this. You are the next pastor. Yes or yes? Yes. Yes. Yes.